Otolaryngology Exams and Procedures lecture. So here's a picture of some tools that can sometimes be used in the otolaryngology exam. We will sometimes use an otoscope, light, tongue depressor, nasal speculum, and a tuning fork. Tuning fork testing measures hearing by air conduction and bone conduction. To activate the fork, hold it by the stem and strike the tine softly on the palm of the hand. Be sure not to strike the palm of the hand too hard, or this is not a clear indicator of accurate and adequate hearing. The Weber test is used if patients report better hearing in one ear, and typically the tuning fork is held on the shoulder. The Rhine test compares air conduction sound with bone conduction sound. In normal hearing, the sound is heard twice as long by air as by bone conduction. Audiometric testing measures the lowest intensity of sound an individual can hear. Wearing headphones, the patient is exposed to sounds and is asked to signal when the sound is heard. If initial screening indicates hearing deficit, an audiologist may be consulted. Audiometer testing. The results are printed on a graph called an audiogram, and the medical assistant charts the results on the graph sheet. An adult with normal hearing can hear tone frequencies below 25 decibels. A child with normal hearing can hear below 15 decibels. Hertz is the pitch of the sound, and decibels is the loudness of the sound. Documenting. So there are abbreviations that we use for the audiogram: AD, AS, and AU. AD is for right ear, AS is for left ear, and AU is both ears. So when documenting, we would have the date and the time, the ear that it was done, the decibels that was heard, and at what hertz. And you would do this for both the right ear and the left ear. And then you would document your name and your credentials. Here are some pictures showing someone doing an audiogram on a patient. Proper fit of the headphones is essential. You want to make sure that the top of the headphones rests comfortably on top of the patient's head. Treatments and procedures. Ear irrigation done to remove excessive or impacted cerumen to remove foreign bodies and treat inflamed ears with an antiseptic solution. Administer irrigating solution with applicator tilted up towards the top of the ear canal. Always chart the treatment and its results immediately after completion. We do many of these in the medical office, and it can vary on ages, anywhere from a child to an older adult. It is important to cover the patient with a drape prior to administering any type of solution to prevent the patient from getting wet. You will also want to look with the otoscope to visualize the cerumen that needs to come out. After you have visualized your cerumen, you will get together your supplies, and oftentimes an elephant ear is used. You will screw on the little plastic applicator and load the bottle with warm water. Make sure it's not too hot for the patient. Once this is done, you can begin the flushing process by aiming the plastic applicator towards the top of the auditory canal. Before you administer any water into the canal, you will want to have the patient help you out by holding a basin just below the ear. This will help catch the water and also any cerumen that comes out. Once you visually see the cerumen come out in the the basin, you will then re-look to make sure you have gotten all the cerumen that was impacted. After this is done, you will flush the water down the sink, and you will take the drape off the patient, and most times physicians will want to re-look at the ears. Instilling otic medications ordered for the ear installation are given to soften impacted cerumen, relieve pain, and as antibiotic drops for an infectious pathogen. It is important to insert the drops into the ear and have the patient keep their head tilted for a minute or two to ensure that the drops have soaked in to the appropriate place, depending on the use of the drops. Examination of the nose and throat, the nasal cavity examined and to test mucous membranes and nostrils. Throat includes the larynx and the pharynx and is seen with mirror tongue depressor and sometimes gauze square pads. Sometimes you may need to collect throat specimens to test for strep throat. Patient education. Use good listening skills, appropriate nonverbal methods, and touch to communicate empathy and understanding. Include family members in patient treatment plan. Offer referrals to community resources when needed. Oftentimes this happens with our patients with vision and hearing problems. Legal and ethical issues. Obtain a patient signature on the NPP form. The NPP is the Notice of Privacy Practices form developed by the facility that outlines the patient's rights and the facility's legal responsibilities to safeguard patient-protected health information. Public facilities must also comply with ADA requirements for physical accommodations with those patients with disabilities. This includes patients who are unable to see and having Braille, and patients who are unable to hear and having different methodologies of communicating.